Legislative session gets underway. Tennessee lawmakers are targeting smoking and vaping. One Senate proposal would require you to be 21 before you can buy cigarettes or vaping products. Another bans smoking or vaping in a car when a child is inside. This all comes as the American Lung Association gives Tennessee a grade of F when it comes to tobacco control. The organization says the state fails regarding prevention, access to services to help people quit, and its tobacco tax. The American Cancer Society also says Tennessee is falling short on cancer policies.
10 News reporter Cole Sullivan shows us how those organizations say lawmakers can make a difference. Cole?
Robin and John, right now Tennessee has no money in the state budget for smoking cessation. That means we're considered among the worst in the nation when it comes to our tobacco policies.
These American Lung Association grades would make your school teacher blush. F, D, F, F, F.
Well, we could definitely be doing better.
It says Tennessee is falling short when it comes to tobacco policy, and that has life and death consequences.
Overall, cancer incidence and cancer rates are down nationally, but they're actually up in Tennessee.
Emily Ogden is Tennessee Government Relations Director for the American Cancer Society. She says 33% of cancer deaths here are related to smoking.
Say we want to do everything to lower the cancer incidences in Tennessee, smoking is probably the #1 thing we can do.
One of her priorities is getting some $4 million for smoking prevention programs put back in the state budget.
Without this money going back in, Tennessee is currently tied for last in the country when it comes to spending money for tobacco cessation.
The money covers local educational programs like the one run by Carrie Thompson at the Knox County Health Department.
Making the public aware that being around children, especially in smoking, can impact their lungs.
She says nicotine addiction is dangerous, even as smokers change methods.
Tobacco use is still prevalent. Now, combustible cigarette use has decreased. However, the electronic use has increased dramatically.
She works with teachers in schools as early as elementary to teach the dangers of smoking, trying to help prevent a problem and make the state healthier.
The money for smoking cessation also pays for local programs that help people quit. The health department says the Tennessee Quit line at 1-800-QUIT-NOW also has free counseling to help people who want to stop smoking.
Cole, thank you. Lawmakers in